Assalamu alaikum. I am Dr. Pervin Akter, Professor and Head, Department of Physiology, Bashundhara Ad-din Medical College, South Keraniganj, Dhaka. My dear student, welcome to online classes. Today I am going to discuss about an important topic, adrenal gland. There are two adrenal glands lies at the superior pole of the two kidneys, weighs about 4 gram. Each gland composed of two parts, adrenal medulla and adrenal cortex. Adrenal medulla, it is about 20% of the gland and secretes epinephrine and non-epinephrine. And adrenal cortex, which is constitutes about 75% of the gland and secretes and entirely different groups of the hormone called corticosteroids. And these hormones are synthesized from the steroid cholesterol and they have the similar chemical formula. And what are the layers of the adrenal cortex? Adrenal cortex has 3 layers. From outer to inner, there is zona glomerulosa, zona fasciculata and zona reticularis. Zona glomerulosa composed of 15% of the adrenal cortex and secretes significant amount of aldosterone because they contain the enzyme aldosterone synthase necessary for the synthesis of the hormone. And secretion of these cells controlled mainly by angiotensin II and potassium. And second layer is the zona fasciculata, which is constitute about 75% of the adrenal cortex, and this layer secretes glucocorticoid, that is the cortisol and corticosterone. And secretion of these cells is controlled by the hormone adrenocorticotropic hormone. And third layer is the zona reticularis, and this layer secretes the adrenal androgen, which is the dihydroepiandrosterone and the androstenedione, and as well as the small amount of estrogen and some glucocorticoid, and secretion is regulated by the adrenocorticotropic hormone. And what are the mineralocorticoid and why they call the mineralocorticoid? They call the mineralocorticoid because they affect the electrolyte, especially they affect the sodium and potassium, and aldosterone has the 90% mineralocorticoid activity, and other mineralocorticoids are deoxycorticosterone, corticosterone, cortisol and cortisone. And why the glucocorticoid is called the glucocorticoid? Because they increase the blood glucose level and they all have also effect on protein and fat metabolism. And cortisol have the 95% glucocorticoid activity, and other glucocorticoids are corticosterone, cortisone, prednisone and dexamethasone. And androgen, important androgen are dihydroepiandrosterone, androstenedione and small amount of estrogen. Now we discuss about the aldosterone, broadly discuss about the aldosterone. Aldosterone is a life-saving hormone, and total loss of aldosterone secretion usually causes the death within the 3 days to 2 weeks. And transport of aldosterone, 60% aldosterone transport with the plasma protein and 40% is freely transport, and aldosterone is metabolized with the liver. And function of aldosterone is very important for the student. Aldosterone increase the reabsorption of sodium and secretion of potassium by the renal tubular cell, especially by the principal cell of the left distal tubule, cortical collecting tubule and collecting duct. Increase aldosterone, increase the sodium ion concentration, increase the extracellular fluid volume and increase the arterial blood pressure. Aldosterone increase the tubular hydrogen ion secretion in exchange for sodium ion. And number 4, function of the aldosterone is it increases the reabsorption of sodium chloride and secretion of potassium by the duct of sweat gland, sebaceous gland and intestinal epithelial cell to conserve the body salt. Why aldosterone is called the life-saving hormone? Without aldosterone, increase the potassium ion concentration in the extracellular fluid and decrease the sodium and chloride ion concentration. So, there is hyperkalemia and hyponatremia. So, there is decrease extracellular fluid volume and decrease the blood volume, decrease cardiac output and decrease blood pressure. So, patient develop shock and death may occur. So, antisequence can be replaced by the development administration of aldosterone. So, the mineralocorticoid or aldosterone is called the life-saving hormone. Mechanism of action of the aldosterone. As the aldosterone is a lipophilic hormone, so the aldosterone diffuses readily into the cytoplasm of the tubular epithelial cell. In the cytoplasm of the cell, aldosterone binds with the receptor of the cell membrane. So, aldosterone and receptor complex diffuses into the cytoplasm, and then aldosterone receptor complex diffuses into the nucleus, inducing one or more specific portion of the DNA to form the messenger RNA. Messenger RNA then diffuses back into the cytoplasm and causes the protein formation in the ribosome. Protein then causes the cell response. So, this is the mechanism of the aldosterone. What is the regulation of the aldosterone secretion? 4 factors regulate the aldosterone secretion. Increase the potassium ion concentration in the extracellular fluid, increase the aldosterone secretion. Increase the angiotensin II concentration in the extracellular fluid, greatly increase the aldosterone secretion. And third number is increase the sodium ion concentration in the extracellular fluid, slightly decrease the aldosterone secretion. And adrenocorticotropic hormone from the anterior pituitary gland is necessary for aldosterone secretion, but has little effect in controlling the rate of secretion. What is the aldosterone escape? Excess aldosterone increases sodium reabsorption along with the water reabsorption. So, there is increased extracellular fluid volume 5 to 15%. It also increases the arterial blood pressure 15 to 25 millimeter mercury. So, increase the kidney excretion of both salt and water called the pressure diuresis and pressure natriuresis. So, elevated arterial blood pressure returns the renal output of salt and water to the normal despite of excess aldosterone. This is called the aldosterone escape. So, this is all about my lecture on adrenal gland. Stay safe at home. All the students, Allah Hafiz.